Hey, great day. So, in this podcast episode, I actually want to walk you through step by step of how I was able to build community partnerships and how it actually started with me as a postdoctoral student working for a supervisor where I was first introduced to consulting as a mental health provider. And then also what strategies I learned that were very valuable from that supervisor that then shaped me in my own private practice, that then grew into clinical services for my group practice. And then later on, 13 years later, here I am as a consultant in the community. So, the goal of this episode is to show how early experiences can also shape scalable systems and outreach strategies for today's providers. So let's go ahead and hop in. So I'm going to be walking you through 8 different stages of how I was first introduced to being a consultant as a mental health provider, and then also how I pretty much helped develop a curriculum that turned into something that was rent and repeatable year after year. And so step number one is what is contractual partnerships? So I had a supervisor during my postdoctoral years, and she had had a contract with a specific community organization where she went out to daycare centers and she worked with teachers, administrative staff. She was building out a clinical internship for pre-doc and then end up being postdoc later for the daycare, which also had like the TK pre-K kids in a child care center. And then also, of course, she was working with the families. Now, these contracts allowed her and then myself being part of her program to provide workshops and mental health support directly to the kids, but also directly to the staff and the parents. So immediately, my takeaway when working with her was that partnerships exposed me to our availability to reach people far beyond one on one services, beyond psychological testing, because that's what we did as well. And it also increased her credibility and it made a huge community impact. So now that I have a better understanding, of course, back then of community partnership, number two is student involvement and ownership. So whether you are by yourself in a solo practice, you have a group practice, or you want clinical supervisees at some point in your group practice. As postdocs myself back then, we were assigned to create relevant workshop topics for parents, teachers, and administrators. So our chosen topic, just because of the timing of the year when she had asked me and another student to create a training curriculum, it was seasonal and relatable to the holidays. So we thought it would be smart just to focus on stress during the holidays. So the lesson during that time when we had to take ownership of creating our own curriculum was to always choose timely, accessible topics that connect to the audience's real experiences. And at that time, we knew that the holidays would bring up stress. So then that led to step number three, the workshop design. Now, I'm all about, even back then, keeping things very simple. So the first workshop, originally it was for the parents of TK and pre-K kids in the daycare center. Our focus was on stress and anxiety, not grief and loss, no multiple issues. We zeroed in only to stress and anxiety. We used very simple research-based tools like stress tests that we learned about in grad school, and also coping strategies that we could provide in some activities in a workshop and provide some handouts via visuals like PowerPoints and PDFs. We created a very short, I'm talking about 10 slides or less, PowerPoint, and we focused on practical implementation and takeaways. So if we were focused on some type of mindfulness activity, we did it actually in the room. And then we gave a handout of how to do it when you go home. Step number four is topic focus strategy. So again, we zeroed in on anxiety. We know that anxiety is a broad category though. So what's really important when you want to position yourself as an expert in a particular area to solve somebody's problem or a group's problem, you also want to narrow it down. We narrowed it from the big category of anxiety to specifically holiday anxiety for parents with young children. Now, here's a tip. Don't try to cover everything. If you are doing a workshop for 30 minutes, 45 minutes, pick one angle and go deep. Do not go wide. Number 5, staff and administrators workshops. And so based off of the workshops and the feedback that we received from the parents, admin, they peeked their head in and some of them kind of sat in a little bit and they realized that it would be a benefit for them to have the workshop as well. So we then took the exact same curriculum, but we adapted the topic for school administrators and the daycare providers, the teachers. Now the focus was shifted to self-care while working, maintaining boundaries, and detaching from work to be present at home because some of them have children as well. We highlighted that daycare and school staff often, the people don't get breaks. They only close on the major holidays, so their mental health needs are very different than the parents. Now, moving on to step 6, we really value feedback and reflection. And so we made it a point, me and I'm going to say my friend, the other intern, we made it a point to always collect feedback forms from the attendees. It doesn't matter who it was. And it was paper-based back then. There was no Google Forms. Feedback revealed overlapping themes from parents, staff, and administrators that gave us, information for what they were also looking for next. It also helped us tailor future workshops that we were actually requested to come back and do to meet their needs more precisely. Again, go deeper and not wide. Give the people exactly what they're asking for. Now, step number 7 is all about sustainability and growth. And so I do believe that you should follow the breadcrumbs. Okay. So demand grew. Parents were asking, when is the next workshop? Even though it was only a one-time thing. Organizations that we were working in requested that the workshops be held quarterly, not just for the parents, but automatically for also the administrators and teachers. Now, the topics we chose based off their feedback, we chose to keep it centered still in stress and anxiety, but we customized it to each group's perspective. And we were also, at least my supervisor, she was contracted to different agencies. And so we chose to, get the feedback from the different agencies. And then based off of what collectively everybody was talking about, then we created the curriculum. Now, over time, my supervisor built a repeatable curriculum with our help, and that became her sustainable model for interns after us. So we pretty much paid it forward for people who came after us, which was nice. Now, step number 8 is for me as an entrepreneur, a full circle moment and more of a personal reflection. I currently coach and mentor mental health providers right now on how to build a profitable, sustainable, beautiful solo private practice. But then we also have a scale program where we take it up a notch and we focus on expandable clinical services such as clinical supervision, therapy groups, and also how to do workshops like this in the community. So now I use similar systems that I've implemented in the past in my group practice and also in my community outreach right now. And that's what we teach the therapists how to do in our Therapist Scale Academy. From contracting, now let me be clear, I'm not a contracts attorney. I do not review contracts, but I will review your proposal and we can talk about what they are requesting of you in the contract and we can cover the clinical part. But when it comes down to contracts, you definitely want to consult with a contracts attorney. Or if you have a CPA and or an attorney, you can talk to them just to make sure that the legalities of your contract is in place. Okay. But in terms of your deliverables, that is something that we cover in our scale program. We also talk about the importance of feedback loops in terms of getting feedback from the agencies that you talk to. Sometimes it may not be where you walk into a situation and someone is signing you up for a $10,000 contract and doing 3 to 5, sessions in a 6-month period of time. Sometimes it's a relationship situation where somebody invites you in. Maybe it's free versus low fee. Maybe it is actually the price that you charge. And your goal is to get as much feedback as possible so that A, you can either pitch a part 2 of the workshop, even if it's not right away. They can have it in the back of their mind if they come across more funding. And then also you can use that feedback to then go pitch yourself for the same workshop, if not deeper or revised, to another agency. But ultimately, you want to do something over and over again so that you're building a curriculum so that you can reuse it. So, my key takeaway for you that I actually used for myself is keep it simple. Simple systems plus community partnerships equal long term impact. Okay. So I really hope that by me sharing some of my past and earlier experiences being exposed to consultants as a mental health provider, but also being very much in the trenches and being okay with learning as I go, implementing as I go, and then taking a lot of what I've learned, building out my own systems, and then bringing it into my own private practice. And now I can pay it forward and I can teach these things to my therapist coaching clients. Okay. And so if you are listening to this as part of our community, make sure that you jot down notes, ideas, and then bring it to our group calls. If you have one-on-one access, to me, you already know what to do. If this happens to make it at some point over to the public podcast, which we do from time to time, especially with a topic like this, then I would highly encourage you DM me on Instagram at Dr. TK Psych. Just let me know that you're very much interested in building out your consulting services. You want to build out community workshops, and we can talk about if the Therapist Scale Academy is the right fit for you. It's a great program, but we ultimately want to have a consultation call with you to make sure that it is a great match for where you're going at minimum in the next 12 months. All right. Talk to you soon.